China says the number of people infected by a mysterious respiratory virus has more than tripled over the weekend. There are now 218 confirmed cases of the new coronavirus virus, most of them in Wuhan, where the outbreak originated. So far, 3 people have died. This is a very serious condition. 4 other cases have been reported outside of China. And scientists say the virus is getting stronger and is being spread by human-to-human contact. And that is especially worrisome, as hundreds of millions of Chinese are expected to travel this week for the Lunar New Year holiday, and then airports around the world are not taking any chances. They are screening passengers for symptoms. Remember the days of SARS, for instance? Now, officials in China think they know where the virus originated. And a warning, some of the images in this story are graphic. Here's Christy Lustout.
Barricaded and guarded by police with masks, Chinese authorities have traced a new deadly virus back to this seafood market in the city of Wuhan. They say a new strain of coronavirus originated here and put an entire region on edge. CNN has obtained this video filmed inside the market, showing that more than seafood was on offer for sale. Images of the market from early December taken by a concerned customer indicate it was apparently selling other live wild animals, including skinned birds, snakes, and raccoon dogs, sparking concern that the virus might have been transmitted from animals to humans. CNN has not independently verified this footage posted on Chinese social media site Weibo, which has since been deleted by government censors, according to the poster. When CNN contacted the market, they would not comment.
The School of Public Health here at Hong Kong University is a leading authority in the study of emerging viral diseases.
Professor Liu Pun is a virologist at the university and was among the first to decode the SARS coronavirus.
I would believe that this Wuhan outbreak was caused by animal virus, and then the animal actually carried this virus and spread to human. And what we know is causing pneumonia, and then they don't respond to normal antibiotic treatment, so which is not surprising. But then in terms of mortality, SARS killed 10% of the infected individual.
Between 2002 and 2003, SARS infected more than 8,000 people and killed 774 in a pandemic that reached 37 countries. Officials say the new virus was first detected in Wuhan on December the 12th. Some of the initial patients were employed at the seafood market. Hundreds of kilometers south of Wuhan, at this market in the southern city of Qingyuan, wild animals are crammed inside cages. Mallard ducks, rodents, even porcupines, to be sold for consumption. It's not a unique sight in markets across China where both animals and humans are in close contact. This footage, not independently verified by CNN, is from Hong Kong broadcaster iCable, filmed on the 6th and 7th of January as the new strain was discovered. No indications any disease is lurking here, but according to the World Health Organization, scenes like this point to the potential risk of a new virus spreading.
These animals, we don't know their history. We don't know what kind of pathogens or viruses that they are having in their body.
In our interface with the animal world, there will always be the danger of spillover. As long as people eat meat, there is going to be some risk of infection.
The coronavirus that causes SARS was traced to the civet cat, a wild animal considered a delicacy in parts of South China. After the SARS outbreak, China outright banned the slaughter and consumption of civet cats in 2004. Local authorities in both Wuhan and Qingyuan tell CNN they don't know anything about the sale of illegal animals at such markets, and there are no open investigations. But 15 years after the ban, in this market in southern China, civet cats are seen lying inside cages, and this stall keeper says he is selling them. Ready for purchase. Christy Lustout, CNN, Hong Kong.
Well, we've just learned that the World Health Organization will hold an emergency meeting on Wednesday in a couple of days to decide whether this coronavirus outbreak is an international public health emergency. Our senior medical correspondent, Elizabeth Cohen, joins me now. So do we know how many of the people who became sick actually went to these markets that Christy Lustout told us about in her report?
So, Hala, we don't have an exact number, but what's important to remember is that we do know that it has spread person to person. Let's take a look at that map that shows where this virus has been. Most of the cases are in Wuhan, but there are cases in other parts of China. There have been a few cases in Thailand and Japan and Korea. And so we know that some of these people did not visit that market, so they did not get it directly from the animals. They got it from a person. And one of the when I talk to experts, they've said the most stunning thing is that according to a Chinese health official on Chinese media, one sick person infected 14 healthcare workers. That is not good news. If that is correct, that means that this truly is infectious. So we know that it can spread person to person. The trick is how easily does it spread person to person? And we just don't know the answer to that right now, Hala.
So that being said, then, are officials concerned? We all remember SARS. We all remember these outbreaks. Are officials concerned that this could be another SARS?
Yes, there definitely are those concerns. Let's take a look at those numbers. So there are two cousins, if you will, to this new coronavirus. One is called MERS, which is Middle East Respiratory Syndrome, which isn't as well known, but is much more recent. So about 2,500 infections, 858 deaths over the past 7 years or so. And then SARS, which you mentioned, more than 8,000 infections. And this was in sort of the 2003, 2004 time range, and 774 deaths. That is precisely what the World Health Organization, the U.S. Centers for Disease Control, that's what they are trying to avoid. And it really, to a great degree, hinges on the question, how easily can this be transmitted person to person? So SARS, for example, did transmit person to person. Fortunately, if you can call it that, it was a little bit difficult. It was people who were hugging and kissing who gave it to each other, people who were sharing forks and knives. Your likelihood of getting it from just passing someone on the street, it wasn't that kind of action that was giving it. That was spreading it, rather. So in this case, we just don't know. Can you get it if you just hug or kiss someone? What kind of contact do you need in order to spread person to person? Because we do know that it does spread person to person.
All right. Well, we are going to keep a close eye on this. Thanks very much for that.
China is urging its citizens not to travel abroad as it struggles to contain the virus that has now killed more than 100 people. The total number of confirmed cases is now at more than 4,500. Several countries, including France, Japan, South Korea and Morocco, have said they will evacuate their citizens from disease-stricken areas. Russia, too, has closed a large part of its border with China over fears of the virus spreading. Hong Kong's leader, Carrie Lam, has been outlining measures that include restrictions on high-speed train and ferry services.
One of the keys to controlling the epidemic is to substantially reduce the flow of people between the two places. In other words, we are not just talking about mainland visitors to Hong Kong, but also Hong Kong travellers to the mainland. And the number of commuters must be reduced substantially both ways.
Let's get more on this and talk to our correspondent in Shanghai, Robin Brandt. Robin, welcome to you. Tell us more about what the Hong Kong authorities have been saying about their attempts to stop it spreading there.
Well, these are pretty draconian measures, aren't they, to try to further prevent the spread of this type of coronavirus from the mainland to Hong Kong. Remember, Hong Kong is a place, an economy certainly already on its knees after a sustained period of protest there. Hong Kong is in recession, but nonetheless, it's going even further in restricting access by people coming from the mainland. These are people visiting for personal reasons, and it's cutting off access through high-speed rail and other land and sea borders as well. So I think one estimation is that it's cutting off access to about 80% of the routes from the mainland into Hong Kong, and it's mainland shoppers in particular who account for a sizable chunk of the spend in Hong Kong. But nonetheless, the authorities there feel the need to go ahead with these restrictions. They don't want to see a repeat of SARS, similar to this, we think, which happened back in 2002, some 18 years ago, which ended up taking lives in Hong Kong and having a significant economic impact there as well. So what you have is one significant part of China, the country as a whole, cutting itself itself off from the mainland this evening in an effort to try to stop the spread of this virus.
The epicentre of this outbreak, of course, the province of Wuhan, where most of the deaths have taken place from victims of this virus. What are officials there saying? How are they coping?
Well, Wuhan is the city at the centre of the province of Hubei, and you're right, it is the epicentre of this outbreak. Well, there are two sides to this, really. You know, the national government in Beijing is throwing all it can at the medical and relief effort by sending military personnel, thousands of medical personnel as well. You know, we've seen much talk about how they're building hospitals in a matter of days. There are going to be 10,000 extra hospital beds available very soon, we're told by officials in Hubei province this morning. But at the same time, they revealed they're still struggling with some of the basics when it comes to logistics. The basics, but very important. They can't get testing kit. There isn't enough of that. There isn't enough protective clothing for medical professionals either, the doctors and nurses who are treating these people. So that shows you that they are facing challenges on a simple logistical level, but this is very important in terms of trying to contain the spread.
Meanwhile, Russia has announced that they're closing a large part of their border as well with China. It seems like hour by hour we're seeing more and more countries putting up restrictions in an attempt to protect themselves.
You're right. I mean, Mongolia yesterday, which has that massive land border that stretches from west to east up in the north. North Korea earlier in the week had done this. Now Russia as well. And, you know, despite appeals from the Beijing government at an urgent meeting of foreign diplomats in Beijing yesterday to not arrange evacuations of some of their citizens, you know, the list grows. South Korea, France, which believes it has up to 1,000 nationals in Wuhan, is looking at trying to get those out as well. Efforts by the US and the UK continue. India as well. So all of these countries do think it is important, do think it's necessary to try to remove their citizens who are currently kind of stranded in Wuhan at the moment.
OK, Robin Brandt in Shanghai for now. Thank you.